Good morning, Dr. Duresti with the Cranial Release Technique. Here, back with another video talking about a follow-up from yesterday's video. I was over in the mall talking about how cranial distortion, when you look at a patient, you see that one eye is low and one eye could be smaller and one cheek could be lower or higher, one ear could be rotated anterior, posterior, forward or back, or up or down. That's all just a sign of cranial distortion. Virtually all of us have it from as far back really as the birth process and all the other traumas that we've had through life. And the whole point of the video yesterday was that when we have these cranial distortions, which virtually everyone has, excuse me, we all have it. The question is, what's the downstream effects of that? So with some people, you'll notice a head tilt to one side, or one high shoulder, or one high hip, or you'll notice one foot sort of flares out, or one foot goes in more like a pigeon toe. And I've seen all those things improve with the application of cranial release. So how is it that a 1-minute cranial technique can change the effects all the way down the line? Well, obviously, number one, there's neurological considerations. So once you address the cranium and restore balance and fully open it and restore the primary respiratory mechanism, the brain, keeping it as simple as possible, is going to be much happier than when it's under this mechanical tension and stress. So everything's going to function better because of that. There's going to be balance in the musculoskeletal system. In addition to that, remember, covering the brain, we have something called the dura mater. For those of you that forgot your Latin, dura mater means tough mother in Latin. So why did the anatomists who gave the name dura mater, why did they call it that? That's always been an interesting question that I've never really got a true answer. My theory is that when they were evaluating the body and they realized that this dura, this covering, covers the brain, covers the spinal cord, and my discussions over the years with other practitioners, we've sort of come to the conclusion that the tough mother means that it's the mother protecting its children. So this white, inelastic, fibrous membrane, stronger than bone, covers the brain and spinal cord, protecting it. But the problem is that as the cranium shifts, rocks, distortion that you see everywhere, like we saw yesterday in the mall, that's going to cause imbalances in the tension of the dura. And that will then cause both neurological, musculoskeletal, organic, visceral, hormonal, immune dysfunctions. So that's the second piece of the puzzle that we can talk about, is how a cranial distortion leads to an osseous or a bony distortion throughout the body, but then it leads to the dural distortion throughout the body. And so there's many factors at play here. And these are all things to think about. So if you are a practitioner, you're a chiropractor, you're a body worker, you're an acupuncturist, you work with people, you're a therapist, a physical therapist, massage therapist, occupational therapist, whatever it is that you do, and you're not addressing the cranium. And by the cranium, I don't mean just occiput atlas. I mean the actual 22 cranial bones that make up the cranium. If you're not addressing that cranial system, and of course it's the craniosacral system, it's one system, then I believe you're missing the main player in the game. And for that reason, you should really visit the website at cranialrelease.com. And at cranialrelease.com, there's more information. You can click on a button that says Online Training Program. And you can click on that, and that will take you to another page to teach you everything you need to know about what is cranial release technique, how does it work, why does it work, how do you do it, why you should learn it to help all these patients that are on your table every single day. Again, cranialrelease.com is the website. Online Training Program is the button. This is Dr. Duresti, Cranial Release Technique. Oh, by the way, if you're not subscribed, hit the subscribe button. Give me the thumbs up. Could use that. That'll spread it to more people around the planet. And I look forward to hearing from you and speaking to you in the very near future. Signing off from beautiful Florida, and it has been a beautiful winter. It's March 19 here in Florida. It's been absolutely beautiful. And hope to see you in Florida soon, or wherever our travels shall meet. Adios, my friends. Goodbye.